You can come in.
I'm coming to my patient's room. I'm providing patient privacy. I'm performing hand hygiene. Hi, Dre, I'm your nurse. Hi, Dre, I'm Casey. I'll be your nurse today. We're going to go ahead and do a thoracic and an abdominal assessment because you're being discharged home.
Okay.
Can I go ahead and get your first and last name?
Adriana Moore.
And can I get your date of birth?
July 2nd, 1990.
Perfect. So the first thing we're going to do is we're going to check your lymphatic system.
Okay.
So for my patient's lymphatic system, I'm going to start at her auricular, and then I'm going to go to her post-auricular. I'm going to chance her tonsillar, submandible, and then her submantle. From here, I will extend down to her anterior cervical, and then I'll go to her post-cervical, and then I'll go to her supraclavicular, and then I'll go to her infraclavicular.
Mm-hmm.
During this, I was not able to palpate any lymph nodes, and this is an expected finding in a healthy individual. So from here, we're going to go ahead and look at her thoracic area and her lungs. So I'm going to go ahead and just inspect her chest. I don't see any color change. The skin is warm and dry. There's no lesions, and the color is even throughout. So for what we're going to do now is we're going to go ahead and I'm also going to assess my patient's AP transfers. So I'm going to have you sit forward. I'm looking at my patient's AP transfers, and she's got a 1-to-2 ratio, which is a expected finding in a healthy individual. This time I'm going to go ahead and listen to your lung sounds. So the first thing we're going to do is we're going to do the phragmitis test. So I'm going to go down your back, and when you feel me press right here, you'll say 99, okay?
Okay. 99. 99. 99. 99. 99.
Perfect. So when I did this, I felt equal vibrations throughout, and there is no consolidation in the lungs. This is an expected finding in a healthy individual. Go ahead and turn back around for me. We're also going to listen to breath sounds. Go ahead and face this way. Oh, goodness. Okay, so when I push the stethoscope up to your chest, go ahead and take a deep breath for me, okay?
Okay.
Okay, so I listened to my patient's breath sounds. They were bilaterally equal, and I did not hear any lung adventitia throughout her lungs. This is an expected finding in a healthy individual. I'm also going to do the egophony test on my patient. So I'm going to have you turn around again for me. When I place this on your back, when you feel me place it on your back, go ahead and say the letter E, okay?
Okay. E. 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 E.
Okay. So as I was listening, I heard E evenly throughout my patient's back. I did not hear the letter A. This means that there is no lung consolidation in my patient, which is an expected finding because she is healthy. The next thing I'm going to do is I'm going to go ahead and do your cardiac area. Mm-hmm. So face me. First thing I'm going to do is I'm going to inspect her area. I'm also going to lay her down.
Oh.
There we go. Okay, so I'm inspecting her area. I do not see any heaves or thrills while she is lying there. Also going to look at the skin again. Skin is even throughout. I don't see any lesions or anything like that. The skin is warm and dry. The next thing I'm going to do is I'm going to go ahead and palpate my pulses. So I will start at my temporal pulse. And I'll go to my carotid pulse. Sorry. I'll do my brachial pulse. And then I'm gonna do, then I'll do my radial pulse. And then I will go down here and I will do my posterior tibialis. And then I'm gonna do my anterior dorsalis pedialis. No, it's just the dorsalis pedialis pulse as well. Okay. As I was feeling her pulses, they were even throughout. I would also do the other side as well, so I could compare them bilaterally. And the grade I would give my pulses is a 2+. Okay, so the next thing I will do is I will osculate my heart sounds. So I will start on this side. This is my aortic, my pulmonic, my herbs, my tricuspid, and then my mitral. As I was listening to her sounds, her S1 was loudest at the apex of the heart, and her S2 sounds were loudest at the base of the heart, which is an expected finding in a normal individual. I also didn't hear any murmurs or whooshing, anything like that. So the next thing we're going to do is abdomen. And I'm going to have you pull up your shirt for me. Perfect. So we're inspecting her abdomen. I'm looking at her abdomen. I don't see any lumps and bumps protruding. I also don't see any lesions. The color is evenly throughout, and it's dry skin, and it's also warm. So next I will go ahead and osculate my abdomen. As I was listening to my patient's abdomen, I heard bowel sounds throughout, which is an expected finding for a normal, healthy individual. I'm also going to go ahead and do percussion on my abdomen now. Sorry, my hands are cold. So I did percussion on my patient's stomach. I heard tympanic sounds all throughout the quadrants, which is a normal expected finding. And then I'm also going to do light percussion on the quadrants. So I'm doing light percussion. Tell me if you feel any pain. Did you feel any pain?
No.
No? Okay. Next I'm going to do a deep percussion. Tell me if you feel any pain.
No.
No pain?
No.
Perfect. All right, so that completes my abdominal assessment. I'm going to seat my patient up, and then I'm going to check my CVA. I'm going to have her face away from me, and I'm going to find her 12th rib, which is right here. Yes, okay. And I'm going to go ahead and percuss, and you tell me if there's any pain, okay?
Mm-hmm. No.
No?
No.
Okay. And so this is a normal expected finding to not feel any pain when I do my CVA test right there. You can go ahead and turn around for me. This completes my thoracic and abdominal assessment. So I'm going to go ahead and open my patient privacy. I'm going to perform hand hygiene, and I'm going to dismiss my patient.